inequality, and structural poverty. A thriving world is only possible when all women, regardless of caste, status, or occupation, can access quality education and comprehensive healthcare without fear, shame, or systematic denial. For communities that are discriminated on work and descent, known as the CGWD women, education is not just a pathway to employment. It is a powerful tool of liberation and can challenge social hierarchy, affirms dignity, and enable political participation. Yet too many of these women are denied the right due to discrimination, segregation, economic exclusion. Similarly, access to health, particularly sexual and reproductive health and rights, remains a critical unmet need. Health service must be inclusive, non-discriminatory, and designed with realities of CGWD women. These women are known as communities discriminated based on work and descent. Health equality is central to survival, autonomy, and leadership. So I have some recommendations that I will give to UN member states, civil society, and all activists that we centered voices and experience of these women, known as the CGWD women, as barriers in both sectors. Let us monitor SDG progress. As you know, this year, the theme of the high-level political forum is, one of the themes is good health and well-being. We have gender equality, we have decent work and economic growth, we have life below water, and we also have partnership for the goals. So in SDG 3, initiating good health and well-being for all without discrimination at all. So part of my recommendations will be to ensure that they invest and dismantle systematic barriers in maybe based on caste, descent, occupation, or to ensure that nobody is left behind. So to empower these women, the CGWD women who are found in Africa, in Asia, in Europe, and in Latin America as well. But speaking on a perspective of Africa, we want to empower these women through education and health, not just as an option, but as a right. It is essential to the dignity of the 2030 agenda and the promise to leave no one behind. So together, we can create a world where every woman can learn, live in dignity, and live a life without discrimination. So thank you so much, Rita, for the invitation. And sorry for the background noise. I am currently at the UN, and it is kind of noisy here. So thank you so much. Thank you.
Well, thank you very much. It was a pleasure to meet you. Next is the Dr. Colleen Kraft, Professor of Pediatrics and 2018 President of American Academy of Pediatrics from Los Angeles, California, is speaking on reaffirming the foundation of child health, education, and development.
Okay. They call my name. All right. So you have to rush. Take care.
Go ahead, Colleen.
Okay. Well, good to see everybody, and really getting back to basics with where our values are as a country and as educators and as just citizens of the world. What I wanted to talk about is how do we reaffirm the foundation of health and child health education and development, because children are our future, and these are all values that we hold despite any politics, despite any differences that we may have in between countries. So the core values are actually from the UN Convention on the Rights of the Child, that children are individuals. They start life as totally dependent beings and really depend on us as adults to do the right thing by them. And that the actions or the inactions of government impact children more strongly than any other group in society because they are dependent on us. And then finally, that children have voices of their own, and their views should be heard and should be considered in the political process. These core values, many changes in society are having a disproportionate and often negative impact on children. We are quite concerned about this in the United States with some of the changes that have been made over the last 6 months. But we know that the healthy development of children is crucial to any of the future well-being of the society, and that costs to society of failing its children is huge. That's our future. This is our first and foremost investment. And in fact, James Heckman, who was a Nobel laureate in economics, really put together this graphic that we refer to as the Heckman curve. When you look at how much you invest in different stages of life and where that investment comes to return, the investment in prenatal programs gives you the highest level of return, followed by programs targeted towards the earliest years, preschool programs, schooling, and job training will give you about a third of the investment as giving money and investing in prenatal programs. So we know that early childhood development is a smart investment. And so many of the programs that we are seeing at risk are really targeted towards prenatal and early childhood. So, what does our commitment to the future have to look like? It has to look like universal health care, evidence-based prevention, including immunizations, global evidence-based treatment, because we know that different places and different cultures may actually have different solutions. Food assistance and programs, both domestic and international, are vital to the success of our children and our society. Universal education, early childhood, primary and secondary education with a particular focus on education of women is important. Saving our planet, having a healthy planet where we have healthy air and water and other resources for our families is vital, as is research and innovation to move our field forward. So, what are the essential services of universal health care? These would look at maternal, newborn, child, and reproductive health, infectious disease, looking and preventing some non-communicable diseases, and then looking at service access and capacity. So that we know that with our maternal and newborn and child and reproductive health, family planning is vital. Antenatal care and safe delivery and maternal mortality is vital for the survival of the mothers and the children. And we know that children don't survive well without mothers. So it's the maternal child duo that's so important. Full child immunization leads to those children developing well and living beyond age 5. And then we know that health seeking behavior for pneumonia is something that helps us treat children and parents early. If you look at the number of lives saved by childhood vaccinations from 1974 to 2024, 50 years, it's really remarkable. And many of our young parents were not around to see their children die and suffer from many of these diseases. But what we know is that we have a total of 154 million lives saved in 50 years from vaccination. The vast majority of that is in measles. And in the United States, we are having the biggest measles outbreak that we've had in a generation, possibly because of people not vaccinating their children. But vaccines are lifesavers. We know that tuberculosis treatment, HIV antiretroviral treatment, use of insecticide-treated bed nets for malaria prevention and adequate sanitation are vitally important. And again, we are seeing these programs cut globally by the US government. Many of us are not in agreement with this. Non-communicable disease is something that is very important throughout the world. How do we prevent and treat high blood pressure, high blood glucose, and particularly the prevention, which has everything to do with the food environment, having enough food, having enough of the right foods to nourish bodies and not increase insulin and blood sugar to cause type 2 diabetes. We know that cervical cancer screening is vital for the protection for women, and that tobacco decreasing smoking rates is one of the best ways to prevent non-communicable diseases. When we look at our highly successful domestic nutrition assistance program, it is called SNAP, which is Supplemental Nutrition Assistance Program. We know that SNAP helps families afford adequate food. So we decrease the level of households who are food insecure with very low food insecurity and where the children were food insecure by SNAP. We have threats of cuts of funding to SNAP, which is really the wrong direction for our country to be going in. How about the World Food Program USA? Really important program. What you see are the countries where the World Food Program works, and that this has been so successful in getting food to where people are starving, where people are food insecure. And it has been vital for many of the farmers in different countries who have more than their stock supply to be able to get this food to areas of need. Child development and education. We reaffirm our commitment to preschool, primary education, and educating women. We know this, we've studied this. So maternal child dyads were studied. And if women have more than 10 years of education, mothers who are educated have more maternal child interactive activities. They have less corporal punishment. They have higher immunization rates, higher child survival rates, and then higher enrollment in preschool for their own children. So we know that educating women and mothers is vital to the survival of all of us as a species, which is why we reaffirm our commitment to this. How about a healthy planet? We know that reducing waste and focusing on reducing the carbon footprint is vital to keeping our planet healthy. We know that reducing single-use plastics, and Rwanda has actually been a model for how we reduce plastic use in a country and how we reduce plastic pollution, plastics and microplastics getting into our food and water sources, and some of the health benefits that come from not having plastics in our system. Really important. Conserving our resources and water is important. Supporting eco-friendly practices, clean energy, really important. Again, this is a place where the United States is going backwards. We need to be looking forward to a clean energy source to keep our planet healthy, to keep our species surviving. And that those of us who are seeing some of these changes are advocating for science-based, evidence-based positive change because a healthy planet is needed for healthy people. Research and innovation continues to be important. This is another place where the United States is going backwards with defunding some of our National Institute of Health projects and many of our research projects. But research is relevant, timely, technically, and ethically sound, really helps to get the knowledge and the evidence to impact. And then research on innovation scale up. What if you have a great solution? How do we get this to other places in the country and in the world so that all of us can benefit from this research? We need to provide this capacity building and leadership. And again, really lobby and advocate for research and innovation, particularly in promoting new treatment for today's diseases and in the area of digital technology to promote health equity, because research is going to carry us forward. We have seen this happen over the last 50 years. It needs to happen in perpetuity. So what I would like to just finish with is just the idea that we are committed to our future, and the commitment to our future is in the foundation of child health, of education, and development. We know this is so important for our species to move forward. And at this high level political forum, those of us who are researchers and scientists and people who work with children and work with families know that this is the way to move forward. And we are staunch in our advocacy for kids, for education, for global programs and domestic programs to promote food security, and for research and innovation to keep our healthy planet healthy. Thank you.
Well, thank you very much, Colleen. Next speaker is Dr. Vanati Gopalakrishnan from University of Pittsburgh, Pennsylvania, USA, and she's presenting on sustainable digital twinning for healthcare, education, and access. Go ahead, Vanati.
Thank you so much, Rita, for introducing me. Can you hear me?
Yes.
Perfect. Hello, everyone. My name is Vanati Gopalakrishnan, and I'm a tenured associate professor of biomedical informatics in the School of Medicine at the University of Pittsburgh. I direct the probe laboratory for pattern recognition from biomedical evidence, and I'm also the founding director of the Pit Vihar Center, focused on building female digital health twins. My talk today is entitled Sustainable Digital Twinning for Healthcare Education and Access. First, let us seek to understand what is digital twinning and what is meant by it. As shown in this figure, obtained from a recent systematic review of the literature, the terms digital model, digital shadow, and digital twin differ in the richness of data integration between the physical and the virtual objects. With digital twins requiring bidirectional data flow, as you can see here. It's crucial to recognize these distinctions as modeling methods create digital replicas from physical artifacts, while twinning methods link the physical and virtual worlds. Understanding these methods is essential for addressing challenges and developing new approaches. Here are examples of digital twin technologies. In the project website for the Astronaut Digital Twin, or ADT technology, they clearly distinguish between traditional digital twinning technologies such as engineered systems and bio-digital twins. Herein, an engineered system of a traditional aircraft engine digital twin is depicted. The feedback loops that maintain a normal state throughout the operating envelope were designed and thus are well understood and available for digital twin development and applied simulation. However, as can be seen in their contrasted example to depict biodigital twins as opposed to the engineered system, the underlying internal states and feedback loops that maintain homeostasis in biological systems must first be reverse engineered from physiological principles and numerous disparate data sets. These systems, physiology models, form a foundational layer for biodigital twins. In addition, the heterogeneity in homeostatic feedback loops driven by genetic, metabolic, lifestyle, and other factors in human populations necessitate the creation of variants of the underlying models such that they reproduce key Kaplan-Meier statistics, hazard ratios, correlations, and other statistical observations for all sets of subpopulations. Creating such a causal and statistical mirror of the human population, we can call it the digital population, is the next foundational layer of digital twins. Here is an example from yet another systematic review paper on digital twins in Healthcare Internet of Things, or IoT, displaying an overview of a Gen AI-based digital twins in healthcare with a focus on ECG data. The same paper also provides a taxonomy of digital twins in the smart healthcare domain. While there are lots of applications, modeling and simulation, cloud and edge computing, and blockchain technologies are primary enablers. Applications include the digital patient and medical devices, among several others. In a 2024 review paper on digital technologies to unlock safe and sustainable opportunities for medical device and healthcare sectors, which was published in the journal Science of the Total Environment, this paper summarizes its contributions using this graphical abstract, depicting how combining artificial intelligence, machine learning, Internet of Medical Things, augmented reality, virtual reality, extended reality, with digital twin, blockchain, and cyber security into the design of medical devices would provide the kind of digital transformation that can impact both patient safety and sustainability. In the same year, a review of digital twin technology training and research in health higher education review summarizes various abbreviations that are available for IoT systems, including the Internet of Everything, abbreviated as IoE, And it also provided this beautiful figure on the right, which shows all the different multidisciplinary aspects of creating an educational program that encompasses biomedical and health informatics. In this paper by Lee et al. On digital twins, etc., for preventive and personalized medicine, which appeared in Genome Medicine, you can see clearly that there are two different patients that have expressions of very different molecular and cellular patterns. And these both of them are depicted for Crohn's disease, for example. And they show how this necessitates vastly different treatments for each patient. And in this figure on the right, it depicts how in a mouse model for arthritis, you can see that it's not just about joints, and that it involves a whole bunch of different organs and different cell types that are expressing different and regulating different sets of genes. So this points out why integrating vast amounts of data is crucial for personalized, preventative, and precision medicine. An AI-enabled paradigm of continuously collected data from the community can be used here as proposed by Pedroso et al. For screening, prediction, and monitoring of cardiovascular conditions. Herein, wearable devices, shown here, and sensors can be used to track various data types and used to predict and give summaries of a particular human being's conditions. Furthermore, the authors also show how you can do data optimization and standardization for interoperability and also suggest various clinical applications. They present a useful table identifying the key challenges for digital health devices used in cardiovascular care and the corresponding AI-driven solutions. I would like to specifically call out this particular aspect related to bias and equity concerns and the proposed solution, which includes how to get data from diverse populations in the development and validation of models. So I will end my presentation with this important innovation that has just recently come out of my lab, where we have developed a comprehensive cardiovascular health risk assessment questionnaire. It's like a survey instrument for diverse populations. The plan is to make this survey instrument available for free for non-commercial use, with commercial use requiring licensing of copyrighted technology from the University of Pittsburgh. Thank you so much.
Oh, thank you. It was very eye-opening. I learned too. Next speaker is Dr. Ganesh Mani from Carnegie Mellon University, Pittsburgh, USA and Africa. And he's presenting his point of view on artificial intelligence and emerging economies. Go ahead, Ganesh.
Thank you, Rita, again for this opportunity. So title of the talk is AI and Emerging Economies. I teach a course by the same name for the CMU Global Audience. I get students from here, from CMU Rwanda and CMU Doha, Qatar. I am an adjunct faculty member. I was in the industry before that. Before we can talk about data and AI, we need to see how folks are accessing the internet. So there is still a little bit of a digital divide. So on the left-hand side, you can see share of the population using the internet. It's grown. North America is close to 100%. There's still a gap in coverage, which companies like Starlink are trying to fix here. But if you sort of go down that graph, you'll see South Asia, Sub-Saharan Africa, still below 50%, right? Both are improving. So you need to first get the population to use the internet. And using the internet just doesn't mean connectivity. On the bottom pane, you can see the speed of internet connection, right? So the darker blue is higher speed. So you need the infrastructure, you need speed, which is part of the infrastructure, and then you need some education, you need some devices, right, on how to access it. You can also see, I think we're a world of haves and have-nots across all three spheres, health, wealth, and wisdom. So some of the health inequity things are shown on the right-hand side there. So how can data and AI fix all these aspects is what we're going to talk about briefly. So digital public infrastructure has a role to play. No tragedy in the commons. Marginal cost of digital public goods is zero or zero plus. So some of this took on some momentum. We've had things like GPS, we've had things like Wikipedia and so on before, but over the last decade, maybe 2 decades, the India payment stack, Aadhaar and so on, connected to universal ID. The whole idea was if you can establish ID for a large population, India is a billion plus, then you can sort of route that to health, wealth, and wisdom, right? You can create opportunities for unbanked to use financial services. You can provide the right kind of medical advice to somebody in the rural area. You can provide some micro badges, certifications, and those are portable. So a factory worker, a driver, etc. So Gates Foundation has been doing a lot of work in pushing the digital public infrastructure. In fact, a friend of Vanity and mine is now the head of DPI at Gates Foundation. So there's a lot of talk about how that can enable further innovations using AI and so on. So what is AI? A lot of people talk about that. It's more augmentation, assisted intelligence, if you will, rather than replacement. In the old days, people were saying we need to understand the brain, and maybe that's how we'll create smarter computers, but we have sort of diverged. So the bird versus airplane analogy is sort of a good one. The airplane is a finely engineered vehicle. Power consumption sort of per capita or per unit of value added is pretty poor, say, compared to a bird. So there are some lessons in there, but that's a good figure of speech, a mental model to think about how AI is progressing. The other mental model is the dual use case. AI is fire, right? That's sort of a metaphor. We know all the advantages of fire from the olden days, and here we are with ICBMs, guns, and all that. So responsible use of AI, much like responsible use of fire, and then there are accidents, much like forest fires and so on. So this is an article pre-LLMs we wrote around the pandemic, and one of the conclusions of that is with the data and AI use, one of the potential mantras could be of the people, by the people, with machines, for the people, and setting up how different geographies will use data science or AI. And data science project tends to be a triad. It's data, domain knowledge, and tools. Now tools are becoming widely available. A DeepSeek tool from China is available in the US. A tool from OpenAI is available in China, India, Sub-Saharan Africa. So tools have become much more egalitarian, much more easy to use across the world. It's the data and the domain knowledge. Either there are regulatory barriers, like we were talking about Rwanda earlier. Rwanda says you cannot take the data out. Many European geos have the GDPR and other requirements and so on. So you've got to figure out how to use the data in an anonymous way, in an opt-in way. If you can't, it's Mountain or the Muhammad, if you can't move the data to large data centers, you have to move the compute to data. So there are some federated learning and other mechanisms and so on. Domain knowledge tends to be super important, local mores, local culture, etc. So importance of local data and domain knowledge needs to be paid attention to. We had come up with some potential challenges for AI to address over the current decade. For instance, in a nursing home, can you have robots and smart infrastructure assist with care, especially as the population is aging and good help is hard to find? Wealth, can you have agents working on your behalf in the background to make sure you're not missing any benefits, your benefits are being delivered on time? Can you use agents to help you in front of a judge, help you whether a media that you're being given access to is fake or not, and so on. So we had set up some um, tests, if you will, winning the cartoon caption contest, explaining the reasoning behind decisions. LLMs often still struggle to, they do a lot of mumbling, all the reasoning tokens and so on, but sort of guaranteeing that um, links to certain evidence in an EMR, links to your personal bank account and so on, information from it to finish a financial transaction. Those are still works in progress. Here are some mappings from AI to use cases, especially in emerging economies. So precision agriculture, can you use combination of remote sensing as well as some instrumented farm equipment to decide when to harvest, when to fertilize, etc. Natural language processing chatbots for education. We just finished up a survey in Rwanda of youth around financial literacy and financial inclusion. I'll talk about that in a second. Generative AI, can you then, if financial literacy is weak, can you create content in local languages? And with low resource languages, these LLMs are still brittle. So some research directions there as well. On the right-hand side is some work by lightweight collaborator, guest speaker in my class, and postdoc at CMU Africa, Emily Eichen. She's done some work along with her faculty advisor and others on providing aid using remote sensing and mobile phone data and mobile money in Togo, for instance, so that aid can reach, financial aid can reach the right person at the right time. There's still data inequality, so this is sort of Gini coefficient. Value of 1 means highest concentration. So in text, it's still high. Due to TikTok and so on, maybe the Gini coefficient is a little lower, but then the quality of the content and whether, there's now a lot of fake AI-generated content on Facebook, TikTok, etc. So both access to high-quality content, vetting it, like we talked about earlier, those are all interesting challenges for AI and very unique sort of governance and low resource specific use cases we need to address. But AI optimism is high. In fact, there are folks in some of the emerging economies who are actually much more optimistic. China, I think that's Thailand here at the bottom. United States, the very bottom is only at sort of 40%, right? So there are folks not only improving their outlook relative to AI, but in the emerging economies, people are more optimistic, which also means we need to sort of co-design with them. I'll come back to that. This is a case study from Kenya, along with the Harvard Business School researchers. I think they gave access to generative AI to some of the Kenyan entrepreneurs. Sometimes magical thinking takes over. They think Gen AI can solve a lot of their small business problems. So I think the right use cases and using it as a co-pilot rather than as an independent, autonomous entity is sort of the right way to go. So impact can be uneven and sometimes even unexpected, as you've seen with your chatbot answers as well. This is some new work out of CMU Africa, along with my colleagues, funded by Afritech, accessing digital financial literacy. So they did a survey of about 300 youth in Rwanda, and then did a pilot study of a handful of people with a chatbot and some interesting learnings there. Essentially, the idea was developing recommendations for digital literacy strategy and programs, what will be helpful. This is sort of an overview of some prior work placed in the context of the FDA. So both Vanki and I were involved in a small company that's now part of the nucleus at ICAD, second reader for mammograms. It was one of the earliest FDA-approved systems, intersecting with AI in the mid-90s. Here's something tongue-in-cheek. At the bottom, a New Yorker cartoon, there's a line saying, I still have room for a second opinion. So many of these second opinion systems in the developed markets could become primary opinion generators in the emerging economies, where it's either no clinician or access to sort of an ersatz or emerging AI system. So it can be used for triage to decide whether a rural person should go into the city for an intervention and so on. This is some work combining collective intelligence and LLMs. If you have 100 people, 150 people, how do you get them to communicate in an inclusive way? If you put them in different rooms, you can divide and conquer, but they don't have cross-pollination. But if you have an LLM sort of listening to the conversation and transmitting information across rooms, you can get consensus that takes into account everybody's view, and some of the things that people may be missing in one room gets transmitted using LLM. So it's a hybrid LLM plus divide and conquer of humans methodology. So what's the call to action? It is funding open source AI toolkits. So some of the current LLMs, even though they are open source, they don't open source everything. A true open source regime would be all data, training regimes, everything you need to know about how it was trained, how it should be used, the model cards and all that. Public-private data partnerships are important. We had an energy summit here at CMU and in Pittsburgh yesterday. There was a lot of talk of energy. Unfortunately, there was a lot of talk about fossil fuels. That still continues. You really need coal-low power instead of coal power. That's co-located power, something nuclear, something solar that directly hooks up with the data center, so there's no transmission issues, there's no transmission loss, and so on. Global AI equity standards are necessary. I think a lot of prior speakers talked about the importance of making sure some of the protected populations like children are taken care of. Obviously, women, underrepresented folks, they need to have a say. So co-designing with AI consumers, where are the bulk of the consumers for AI? It's in the emerging economies. So we need to co-design, while a lot of the AI production now is coming from the West or is being controlled by the government. So that's an important dimension. Responsible AI, everybody talks about it, but it hasn't been fine-tuned. It means different things to different people, but fairness, transparency, accountability, easier said than done. Those are dimensions we need to first define, measure, have checks and balances to make sure, and fairness is not something where you can get some consensus around what it means. So we want to essentially ensure AI is a catalyst, not a divider, in the service of all the SDG goals. This is the AI and emerging economies class I teach by Zoom in the fall, Tuesdays, Thursdays, 11 a.m. Often I'm looking for some guest speakers, so I may call on you to be a guest speaker in the class. But thank you again for the opportunity. Rita, back to you again.
Well, thank you very much, Ganesh. It was fantastic. Now, my friend and my neighbor, Mr. David D. Sabito from Western New England University in Springfield, Massachusetts, he's expressing his provocations on generative AI's untapped potential. Go ahead, David.
Okay, let me see if I can share here and then we'll get started. All right. So my talk today is asking a pretty big question. What if AI literacy became a new global health imperative? And couple things to get started. Thank you, everyone. Thank you, Dr. Luthra, and thank you, Women's Health and Education Center. So, my passion and work is mainly focused on education and business, and I have a special interest in harnessing and integrating the power of generative artificial intelligence. Um, I founded a company called AI Integrated Concepts in May 19 of 2024, and I've been appointed as the AI liaison to the College of Business, and I'm chairing its AI working group at Western New England University. So the big question, what if AI literacy became a new global health imperative? I just, want to review quickly, uh, you know, what is AI literacy? The ability to critically understand, safely use, and effectively engage with artificial intelligence technologies, especially Gen AI, within everyday life, education, and health contexts. So I think the main thing here is to effectively engage. And just, what is the global health imperative? And it's a critical and urgent public health priority. Provocations. I felt like we need to be provoked, and I'm thinking about the subject matter. It became apparent that we need a call to action. So in terms of Gen AI, I wanted to specifically, sort of focus in on what I'm talking about. Like ChatGPT specifically, it's a type of artificial intelligence trained on vast amounts of internet source data to generate new human-like context. And it can simulate and stimulate conversations, summarize complex topics, translate languages, and create educational health-related content. It's pretty much allows us to expand our own curiosities and help us answer questions. It can really be used for educational purposes to learn about new things that you don't know anything about. This is very powerful and really leverage what we know and what we want to know. So the unrealized or underutilized capacity of Gen AI to improve public health, expand educational access, reduce inequity, and empower underserved populations is, I think, still virtually untapped. So, in thinking about these points, I had five questions that I really wanted to look at and think about and have us all sort of ponder. So, what if AI fluency were as vital as literacy or vaccines? I mean, that's a very good question. And what if the next gender gap is AI literacy? And what if Gen AI could teach the world, but only a few are taught how to use it? And what if low AI literacy fuels health misinformation? And that one's particularly scary to me, because I think low AI literacy is fueling health misinformation in many ways. And what if only the privileged shape the AI future? So these are questions I wanted to look into. So the first one, what if AI fluency were as vital as literacy or vaccines? Um, if this is true, if AI fluency is vital, then we must treat it as a public health priority. AI fluency is rapidly becoming a foundational skill akin to reading or, acquiring vaccines, essentially not only for workforce access, but for social well-being. The World Economic Forum asserts that AI and digital skills should be embedded in all levels of education to ensure equitable human development. Leading researchers have also called for governments to treat AI literacy as a public good and a health protection measure, especially in light of its role in shaping decision-making and well-being. The second question is, what if the next gender gap is AI literacy? We don't want that to happen. We must center girls and women in all AI education efforts. Women are 20 to 22% less likely than men to use generative AI tools like ChatGPT and Gemini, despite equal exposure in the workplace and classroom. Harvard research warns that if AI education remains male-dominated, it may reinforce gendered job displacement and further marginalize women from shaping future technologies. Closing this gap now is critical for gender equity across health, education, and digital rights. So the third question is, what if Gen AI could teach the world, but fewer are taught to use it? Universal AI literacy is essential for equitable access. Generative AI has the potential to expand learning opportunities worldwide, but only if users know how to engage with it critically. UNESCO emphasizes that education systems must embed AI literacy to prevent exclusion and ensure safe, effective use. And alarmingly, nearly half of Gen Z users struggle to understand how AI works, making them vulnerable to over-reliance or misuse. So without global AI education, its benefits will remain unevenly distributed, and we don't want that. So the fourth question, what if low AI literacy fuels health misinformation? If that's true, educating users is key to digital and health resilience. Poor artificial intelligence and digital literacy leave individuals vulnerable to persuasive, inaccurate health content generated by artificial intelligence. The World Health Organization research links low e-health literacy with higher risks of falling for false medical claims. Boosting AI literacy helps people spot misinformation and improves health decisions and strengthens public resilience during crises like pandemics. So this one really, hits home to me with all that's going on in the world. And it could be partially responsible for the measles outbreaks in US, among many other things. So the fifth question is, what if only the privileged shape the AI future? if this is true, we risk building systems that exclude the majority. AI systems designed by a narrow privileged group often fail to serve diverse global populations. The AI Now Institute's Discriminating Systems report calls out the lack of gender and racial diversity in AI design, warning that this leads to biased outputs and exclusionary tools. So without inclusive development, AI risks replicating structural inequality and marginalizing billions from digital participation. So these five questions to ponder, you know, I think are useful in helping us, answer this question. Should AI literacy become a new global health imperative? So these are my sources if you're interested. And thank you all, and thank you, Women's Health and Education Center, especially Dr. Luthra, for the invitation to come and speak with you today.
Thank you, David. It was really very positive. Yes, I will go for AI literacy. People have such a black and white impression about AI, and even the educated people, like physicians and healthcare providers and educators and everything. So, health literacy should be taught in medical schools and pre-medical schools. That will be my impression. Well, we all did very well on our time. We have some 5 minutes more. So if you guys want to condense your projects, whatever you're working on it, or your impression in 2 minutes. So each speaker has a 2 minute, condense it, and let's start. I see Vanati here. You want to start, Vanati?
I mean, the projects that we are working on have to do with female digital health twin development, and that is a very long process, but many of them involve parts of what we had proposed for the UNESCO chair in global partnerships for digital health and lifelong education. So I'm seriously very happy that we have a lot of people who are jumping in and wanting to become partners with us. So I truly hope that the UNESCO will acknowledge that, and that we will have a positive outcome, and that we will be able to establish a UNESCO chair in digital health and lifelong learning with global
Absolutely.
partnerships.
No, I will keep on pursuing with UNESCO. I won't let it go. You know how insistent I am.
Yes,
So,
we have partners from Egypt who are interested. So the Egyptian population, thanks to Dr. Ganesh Mani, who we did a lot of traveling to Rwanda and to Egypt and to get partners on board. So I think this will be very nice.
and I had written recently when our HLPF written statement and the side event got accepted to UN Secretary General, condensing it and everything, and it won't go ignored or something. I think I will hear something positive there too. So, well, thank you. We will keep on going. Ganesh, 2 minutes, condense it.
Yeah, no, I just wanted to underscore what some of the other folks have already mentioned, especially David brought it up to the forefront again. I think AI literacy, financial literacy, health literacy, these are all interlinked, right? One sort of
Yes.
feeds into the other. So we need public-private partnerships. Here, there's a lot of debate on what universities should be doing, whether funding should continue at the same levels from NSF, NIH, etc. I think the answer is some sort of public-private partnerships, maybe some risk capital coming from investors. There are large pools of money from the sovereign wealth funds, pension funds, so they need to get involved in early stage research and in the translation. And also, come up with the low-cost digital public infrastructure that everybody can use, and then companies can still do some private innovation for profit on top of that. But there's no point in replicating these things. You don't need 38 different LLMs. You need two or three, but that works well for 380 or even more languages and low resource settings and so on. So there's a lot of work to be done in harmonizing things and also not wasting resources, paying attention to things like climate change and all that. So that would be some additional thoughts, Rita. Thanks again for the opportunity.
Thank you. David, you want to respond?
Yeah, I think it's very interesting that we mentioned all different types of literacy, AI literacy, and financial literacy, et cetera. And one of the things that I'm finding the more that I dive into the generative artificial intelligence world, the more I work with it, the more research I do to learn about it, the more I'm realizing that everything comes back, to letters, and it doesn't matter what discipline you're coming from, or what language that you practice speaking. Um, letters become words, and words um, combined together become sentences and thoughts. And the way that the generative artificial intelligence works with these large language models is basically just vacuuming up the entire internet, et cetera, and seeing how humans have put together these letters into words, into thoughts, into sentences, into paragraphs, and breaks them all down, um, uh, and understanding that uh, it's all interconnected. The other aspect of it is that really, bothers me is if you don't understand this, the way things come together, um, it's hard to see how when things are um, when someone has a particular narrative they're trying to push, or a different political view, and partially fact-based um, misinformation and disinformation, purposely disseminated false information, you know, um, getting that literacy skill of understanding, how true scientific method, works, and how that fits into AI literacy, I think is important for the world.
Well, thank you, David. I'm glad Colleen is here. I want to condense it in 2 minutes about the universal health care, which is very important. I don't think we are going in the right direction as far as in USA healthcare policies are concerned. Go ahead,
Well,
Colleen.
I think that David had a great point in that when we're looking at newer and innovative ways of learning, that is all built on the foundation, on the fundamentals. And the fundamentals of learning are first and foremost good health. So that really speaks to the need for universal health care, everything from prenatal to early childhood to infectious diseases to vaccines. All of the progress that we have made in the last 50 to 100 years is at risk of being lost, and we cannot have that happen. We've got to be able to find those basics and then to move forward to put the investment that we as a country have made in global health programs, global food programs, and our own research so that we can get to the next level of generative AI. When we can look at, in my own practical world, knowing what technology is out there that can help out with screening kids for blindness, screening kids for autism, getting kids into mental health therapy where they can practice skills. All of this is really important, but it all helms back to what we already have and what we cannot lose, which is universal health care, universal education.
Thank you. I think Alima Tal is still here. Uh, Alima, do you want to condense in 2 minutes your work in Africa? Hello? I think she has left, recently left, but she liked it. Oh, here it is. Okay, 2 minutes, condense it. Yeah, go ahead. I think she has to go. Any other last sentence? Okay, Alima is talking.
Sorry, Dr. Rita. Where I am is kind of noisy. I am at the main hall at the UN. So I've written something on the chat.
Uh-huh.
Thank
Yeah.
you so much.
Okay, I'm glad.
Bosnia and Herzegovina and Georgia, as well as San Marino, aligned.
No, we can't hear you, unfortunately. Well, next time you will join us again, won't you? Anyway, I think we are at the end of the time. And till we meet again, I will stop the recording at this time.